According to Ayurveda, we understand the body based on the five element theory. I come from Tamil Nadu, where we don't study Hindi because, our second language is Tamil, first language is English. So Hindi is a choice, optional. And Ayurveda, everything is written in Sanskrit, right? So I have to study from AAE, from the basics.
So you also have been in touch with a lot of celebrities. मतलब आप अर्चना पूरन सिंह, श्रद्धा कपूर, कपिल शर्मा, इन सब के साथ भी आपने काफ़ी काम किया हुआ है.
So these five elements derive into three functional elements called Vata, Pitta, and Kapha.
There is one thing called as chakras. आपकी बॉडी में चक्रास होते हैं अलग अलग पॉइंट पार्ट पे, एंड इफ दोज चक्रास आर इम्बैलेंस तो कहीं ना कहीं हमारी डिजीज मैनिफेस्ट होती है. तो ये सारी ये फिलोसफीज अलग होती हैं या ये भी हम आयुर्वेदा में इनवाइट करते हैं?
So Ayurveda में what we are giving, that's basically plants which are natural, which are accustomed to our body. For example, ginger, garlic, pepper, tulsi, whatever you are actually using in your cooking. Those things only we are giving as medicine.
क्या मैं प्रिवेंशन के लिए एक पंचकर्मा अपनी लाइफ में रेगुलरली अप्लाई कर सकता हूँ?
Yes, मैं उसको recommend करता हूँ क्योंकि it's like servicing the car.
Hello, Dr. Godwin. How are you? Welcome to the Vedic Roots podcast.
Hi Shubham, thank you very much for inviting me. I'm doing very well. आप कैसे हैं?
I'm doing extremely good. Thank you so much. I mean, आज का जो ये podcast है ना, I'm really excited to be here with you because I think आज का जो podcast होगा ना, that is very insightful and that could be, जो काफ़ी सारे हमारे viewers हैं ना, वो आपके experience का benefit ज़रूर लेना चाहेंगे. So I think overall this conversation would turn out to be really fruitful because मुझे लगता है आपका जो experience है ना, वो बहुत बहुत ज़्यादा valuable है.
Thank you, Shubham. Yeah. Even I'm excited to talk to you today and share some of my experiences and my journey, in Ayurveda. Yeah, looking
Great,
forward.
great. So, I mean, before we begin, I think viewers would also like to know a bit about you. I mean, कहाँ से आप belong करते हैं? What is your background? कहाँ पे आप practice करते हैं? So, please आप थोड़ा सा बताइए ना viewers को.
Sure. So अभी फिलहाल मैं बैंगलोर में प्रैक्टिस कर रहा हूँ लास्ट 15 years. But I'm originally from Tamil Nadu, Chennai. So that's where I did my schooling, my Ayurvedic medicine. So Ayurvedic medicine मैंने 97 to 2003 किया है. That's where I finished the year. And यूनिवर्सिटी था कांची यूनिवर्सिटी, जयेंद्र सरस्वती आयुर्वेदा कॉलेज.
Okay.
सो तमिलनाडु में 4-5 कॉलेजेस हैं, उसमें ये कॉलेज थोड़ा स्टैंडर्ड अच्छा है, मतलब इन टर्म्स ऑफ एजुकेशन वाइज. सो उसके बाद मैंने डिफरेंट आयुर्वेदा इंस्टीट्यूट्स पे काम किया है. बेसिकली टू टेल यू द ट्रूथ, आयुर्वेदा एजुकेशन खत्म करने के बाद एवरी स्टूडेंट हु स्टडीड आयुर्वेदा, उनका माइंड में कंफ्यूजन है. अभी मैं थोड़ा मिक्सोपैथी करूं, प्योर आयुर्वेदा करूं, और एलोपैथी करूं, क्योंकि इंडिया में अलग अलग स्टेट्स में डिफरेंट डिफरेंट रूल्स हैं. सम स्टेट्स अलाउ यू टू प्रैक्टिस एलोपैथी विद प्रॉपर लाइसेंस एंड ऑल. सम स्टेट्स में वो पॉसिबल नहीं है. सो ऐसा कुछ कंफ्यूजन होता है माइंड में. देन मैं एक आयुर्वेदिक गुरु को ढूंढ रहा था, क्योंकि एज यू नो, एनी साइंस, लाइक अब अभी आपको कुछ बड़ा लॉयर बनना है, देन यू हैव टू गो विद अ सीनियर लॉयर एंड लर्न फ्रॉम द बेसिक्स, राइट? इवन दो आपके पास डिग्री है, बट फिर भी नोबडी विल कम टू यू, क्योंकि आपके पास एक्सपीरियंस नहीं है, राइट?
Right.
सो इसलिए आई वाज सर्चिंग फॉर अ गुरु. लकीली आई गॉट एन आयुर्वेदा गुरु हु इज फ्रॉम कोटकल. उनके साथ मैंने 2-3 साल काम किया. देन फंडामेंटल्स थोड़ा स्ट्रांग होने के बाद देन आई स्टार्टेड वर्किंग इन डिफरेंट इंस्टीट्यूट्स. 1-2 साल केरला में काम किया था. देन कोयम्बतूर में एक कंपनी है आयुर्वेद वैद्य फार्मेसी करके, एवीपी. सो दे हैव अ वेरी बिग हॉस्पिटल, 225 बेड. सो वहाँ पे बहुत सारे डिग्निटरीज को ट्रीटमेंट किए थे. मतलब हमारा एक्स प्रेसिडेंट अब्दुल कलाम जी, के आर
Okay.
नारायणन, ए बी और प्राइम मिनिस्टर वाजपेयी जी, सो दे ऑल हैव टेकन ट्रीटमेंट देयर. सो वहाँ पे मैंने 5 साल काम किया है. सो आई स्ट्रेंथन माई आयुर्वेदिक नॉलेज वहाँ से. देन उसके बाद मैंने आई केम टू बैंगलोर. बैंगलोर में डिफरेंट इंस्टीट्यूट्स में मैंने काम किया है। एस पी एस यूनिवर्सिटी में आई वॉज आयुर्वेदा हेड फॉर 3-4 years.
Okay.
देन आर्ट ऑफ लिविंग, श्री श्री
Hmm.
रविशंकर, दे हैव अ बिग आयुर्वेदा कॉलेज।
Okay.
और एक पंचकर्मा इंस्टीट्यूट भी है, सो वहाँ पे आई वर्क एज ए सीनियर फिजिशियन।
Hmm.
देन उसके बाद 8 साल मैंने केरला आयुर्वेदा लिमिटेड एक कंपनी है, उनका
Hmm.
एक फ्लैगशिप आयुर्वेदा रिट्रीट है,
Hmm.
आयुर्वेदा ग्राम करके। सो आई वर्क देयर फॉर 8 years, सो ऑलमोस्ट 20 years इन माई करियर। देन उसके बाद मैंने सोचा अभी कुछ ओन ब्रांड बिल्ड करना है। सो लास्ट ईयर आई केम आउट ऑफ माई जॉब। देन अभी मैं नया कंपनी मैंने शुरू किया विथ माई पार्टनर, दैट्स कॉल्ड आयुर रक्षा हेल्थ केयर प्राइवेट लिमिटेड। सो उसके थ्रू हम एक इंडिया के सबसे बड़ा आयुर्वेदिक वेलनेस रिट्रीट अंडर कंस्ट्रक्शन है अभी, मतलब कंस्ट्रक्शन शुरू होगा 1-2 महीने के बाद, बट प्लानिंग चल रहा है। मतलब
Okay.
अराउंड 170 बेड्स, यू कैन से, इन 11 acres प्रॉपर्टी।
Hmm.
सो इट्स बीन क्वाइट एक्साइटिंग जर्नी, 20 साल इस फील्ड पे।
अमेजिंग अमेजिंग। तो ये आपकी जर्नी, ये आपकी जर्नी शुरू कैसे हुई? आई मीन व्हाट इंस्पायर्ड यू टू बिकम एन आयुर्वेदिक डॉक्टर? आई मीन हाउ डिड यू फील कि नहीं मुझे आयुर्वेदिक डॉक्टर बनना है? वाज इट द रिजल्ट्स? वाज इट समवन हु इंस्पायर्ड यू? हाउ डिड योर जर्नी स्टार्ट?
Very good question. So, as I said, I'm from Tamil Nadu. So, our family belongs to southern part of Tamil Nadu near Madurai, Tuticorin, that side.
Okay.
So, my grandfather was a very famous Vaidya in those region in the 50s and 60s. Like when my father was very young, I think 8 or 9 years. Unfortunately, he passed away very young.
Okay.
So my father and two of his brothers, they went into different field because they did not learn that from the father because they were all quite young. So when I was growing up in school, my uncle, my father's elder brother, so he was from Indian Army. So he actually served in Madras Sappers MEG for almost 20 years. Then he came out and started his own real estate business in Bangalore. So when I was growing up, he actually inspired me to study Ayurveda.
Okay.
Also, I heard a lot of stories about my grandfather's achievements and all in the field through my grandmother.
Okay.
So growing up, I heard a lot of stories about him saving people from snake bite, cobra bite, and so many other complicated, issues. Even though it was a small town, small village area, so he used to actually treat a lot of people, and he had a lot of like goodwill and good respect among the people there in those areas. So maybe because of the gene or so, I was kind of growing up. By around my ninth, 10th grade itself, I know for sure I'm going to study Ayurveda because,
Okay.
you know, you always hear about it, like this is the way. But I wanted to become a doctor, anyway. But then since my uncle inspired me to study Ayurveda, so that's how I actually, took up my interest to study Ayurveda.
अमेजिंग अमेजिंग अमेजिंग। तो कैसा अभी आफ्टर सो मेनी इयर्स कैसा लगता है आपको इस जर्नी में? मतलब हाउ डू यू फील एज एन आयुर्वेदिक डॉक्टर टुडे?
Feel really gifted and very fortunate क्योंकि first year अभी हम Ayurveda, when you join the college, I come from Tamil Nadu, where we don't study Hindi because our second language is Tamil, first language is English.
ओके।
So Hindi is a choice, optional, and Ayurveda, everything is written in Sanskrit, right? So I have to study from AAE, from the basics, meaning somebody who come from the Hindi
या।
background, maybe for them it's easy to read Sanskrit. So पहले first year तो बहुत confusion था क्योंकि you come from a like what do you call the modern understanding of science like physics, chemistry, botany, zoology, and then
ओके।
you go into Sanskrit and philosophy and shlokas and things like that, which was a little confusion in the first year. But then I'm glad I have chosen this career because I see by the time I finished my final year and went into internship, I was very clear that this is the future for me because there is no other science which would have given me that kind of confidence. Because every science has advantage and disadvantage,
Yeah,
right? Uh, the reason I said I'm very fortunate and I'm glad I did this because nowadays, if you see in the last 30 years or so, a lot of lifestyle diseases have come up,
exactly,
right?
exactly.
Which of course we'll be discussing in the
Right,
next few, things. I would like to elaborate on those.
definitely.
So इसलिए मैंने I feel good confident that उस areas में मैं कुछ contribute कर कर रहा हूँ. मतलब lifestyle diseases are becoming very very high nowadays, right? So इसलिए I feel very happy and glad that I have chosen this career
I'm
and this
I'm
path.
glad. I'm glad to hear this. I think जो भी लोग आयुर्वेदा को जानते हैं उनका मुझे लगता है सबका यही आउटलुक है. बट आज मुझे एक जनरल एक सवाल रहता है, एंड आई थिंक बहुत सारे व्यूअर्स को भी ये सवाल रहता होगा कि हम आयुर्वेदा को ना आज जानते हैं. हम जानते हैं कि ये आज से नहीं 5,000 साल से एग्जिस्ट करती है, और कहीं ना कहीं हम जानते हैं इसके कितने बेनिफिट्स हैं. लेकिन जैसे जैसे मॉडर्न साइंस डेवलप होती जा रही है, हम वो चीज़ कहीं ना कहीं वी आर फॉरगेटिंग दैट पार्ट ऑल्सो. प्रॉबली बिकॉज हम मॉडर्न साइंस में आज घुसते जा रहे हैं, जिस वजह से हम थोड़ा थोड़ा ट्रेडिशनल चीज़ें हम थोड़ा भूल रहे थे. लेकिन कहीं ना कहीं आज जो चीज़ें अब वापस से बदल रही हैं, राइट. अब जैसे कोविड हो गया तो लोगों का भरोसा जो है इन सारी चीज़ों पे वापस बढ़ता जा रहा है. बट आई थिंक बिफोर दैट एज वेल, लॉट ऑफ पीपल वुड like to know from you ki what exactly is Ayurveda and how is it different from modern science today?
Okay, I think you have combined two questions in that.
Yeah.
So, Pehla, what I understand is like, yes, Ayurveda is 5,000 years old. So, if you see, we have evolved as country, right? Like, of course, India was not a one country at the time. It was like different kingdoms, right? So this was our traditional system of medicine. Like Britishers were not there at the time. So only medicinal system India में सब लोग यूज कर रहे थे. That is our own traditional system. इंडिया में आयुर्वेदा था और तमिलनाडु में सिद्धा करके एक आयुर्वेद
Right,
हेर्बल
right.
सिस्टम है. सिमिलर कॉन्सेप्ट्स बट थोड़ा सा डिफरेंट है. So that's where people were like Vaidyas, वो physicians को we call it as Vaidyas. So उसके बाद बहुत सारे invasions हुए हैं, right? Like we had Mughals coming into India and then occupying, ruling for some time.
Yeah.
Then उसके बाद Britishers. So modern medicine भी establish हो गया. So अभी भी if you see modern, आपने बोला है modern medicine advance होता जा रहा है. I
Right.
slightly disagree on that क्योंकि modern medicine has reached in a saturation point. मतलब they have gone to the tip, like in terms of how much they can actually do. Yes, surgeries हैं, मतलब emergency हैं, accidents and all. Yes, we need the medical science. But अभी if you see, अभी लोगों के पास what is the main problems right now? What we have is lifestyle disorders, right? Infections, TB, cholera, smallpox, whatever happened, all those vaccinations done. अभी तो virus bacteria बहुत कम है. Of course covid we had, but उसके पहले if you see, the most common diseases where people are affected is diabetes, blood pressure, heart disease,
Right.
obesity, cancer,
Yeah.
autoimmune diseases. So ये सब के लिए, if you really see the underlying factor, modern medical system के पास proper solution नहीं है. मतलब they can manage
Exactly.
certain symptoms, बट क्योर ऐसा वर्ड नहीं यूज करते हैं, राइट? क्योंकि ये सब लाइफस्टाइल डिजीजेस हैं, डिफरेंट रीजन से इट कम्स. सो सिंस आयुर्वेदा कम्स फ्रॉम ओल अंडरस्टैंडिंग ऑफ द ह्यूमन बॉडी. मतलब हम एक पर्सन को ट्रीट करते हैं, सो वी डोंट ट्रीट द सिम्टम, वी डोंट ट्रीट द डिजीज, वी ट्रीट द इंडिविजुअल. मतलब अभी शुभम, लेट्स से इफ आई हैव टू ट्रीट शुभम, then Shubham will have some health issues, but I am not treating the health issues what Shubham has. I'm actually treating Shubham. मतलब उनका फूड हैबिट्स कैसे हैं, उनका लाइफस्टाइल कैसे हैं, व्हाट वाज हिज लास्ट 20-30 years ऑफ हिज हेल्थ. सो बहुत सारे हिस्ट्री वी हैव टू सी, right? That
Okay.
means we see the whole body as a single unit. So
Okay.
physical body, metaphysical mind, five sense organs, and then Atma or soul. These four entity mix करके एक human being है, right?
Right.
So when we treat a patient, or we call it as rogi in Sanskrit, so we treat the full person as a whole. So physically, mentally, we have to guide the person. So if you ask the main difference, what is the difference between Ayurveda and the modern science? Uh, this is the fundamental difference. Ayurveda में we come from inside to outside. Modern science comes from outside to inside. मतलब मॉडर्न सिस्टम में द डायग्नोसिस इज डन विद लॉट ऑफ इन्वेस्टिगेशंस, राइट? ब्लड टेस्ट, एमआरआई, स्कैन रिपोर्ट. सो
Right.
डायग्नोसिस इज गुड, मे बी दे विल अंडरस्टैंड द डिजीज, ओके, डिजीज का नाम दे विल अंडरस्टैंड.
Right.
बट उसके बाद सॉल्यूशन भी देना है,
Exactly.
राइट?
Exactly.
लेट्स से आई डायग्नोस यू एज हैविंग मल्टीपल स्क्लेरोसिस, एग्जांपल. Then modern medical science will say, Shubham, we don't have any treatment for this. ये autoimmune disease है, condition है, थोड़ा मैनेज कर सकते हैं, but we don't have a cure for it. So to the true science is not only about diagnosing the problem, उसका एक नाम देना, it's also about giving the solution to that person. So the person is more interested in getting the solution, getting
Exactly.
cured, or
Exactly.
get rid of the problem, not get some fancy names. Like tomorrow, if you invent a new disease, it will be like Shubham syndrome or something like that, right? Because you invented it. Or you identified it, or you discovered it. So Ayurveda is more focused on giving the solution to the person rather than diagnosing. Because our diagnosis is, if you see the textbook, only 22 23 diseases textbooks में mention किया है, मतलब
Okay.
different conditions.
Okay.
So whatever new diseases comes in the future, वो सब इस 22 23 diseases के अंदर हम correlate कर सकते हैं. उतना deep
Okay.
है science.
Okay. 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 So you're saying कि multiple sclerosis जैसी डिजीज भी कहीं ना कहीं उन्हीं imbalances की वजह से, जो शायद आपने वो जो 22 डिजीजेस हैं उसी के अंदर कहीं ना कहीं उसका रिलेशन है, जो कि हम कहीं ना कहीं एक आयुर्वेदिक पर्सपेक्टिव से अगर हम देखें, फुल बॉडी अप्रोच को अगर हम देखें, तो उसका सोल्यूशन वहाँ से निकल सकता है.
Correct, correct. So if you see underlying factor, अभी स्ट्रक्चरली बात करेंगे. सो एनी मेडिकल साइंस, उनका मेन इंटेंशन क्या है? द फिजिकल स्ट्रक्चर व्हाट वी सी, राइट? द बोन्स, द मसल्स, द टिश्यूज, व्हाट एवर दैट्स कॉल्ड फिजिकल स्ट्रक्चर,
ओके.
राइट? उस स्ट्रक्चर को कोई डैमेज नहीं होना चाहिए, राइट?
ओके.
दैट इज द मेन एम ऑफ एनी मेडिकल साइंस, उस स्ट्रक्चर
राइट.
को प्रोटेक्ट करना है,
ठीक है.
राइट? अभी आप डॉक्टर के पास जाएंगे, इफ यू से आई हैव सम चेस्ट पेन और व्हाटएवर, सम काइंड ऑफ इशू, स्टमक पेन, देन डॉक्टर वांट्स टू नो स्ट्रक्चरली कुछ डैमेज हुआ, ऑलरेडी हो चुका है, देन दे सेंड यू फॉर अल्ट्रासाउंड और एमआरआई और सीटी स्कैन और ब्लड टेस्ट, राइट? सो yes, there are functional imbalances भी, but most important thing, structurally कुछ डैमेज नहीं होना चाहिए.
ओके.
दैट इज द एम ऑफ एनी मेडिकल साइंस. सो आयुर्वेदा में इस स्ट्रक्चर को हम सेवन धातुस बोलते हैं, सेवन डिफरेंट लेवल्स ऑफ टिश्यूज.
ओके.
सो उसको कैसे प्रोटेक्ट करना है, उससे इन दोस टिश्यूज में कैसे डिजीज अफेक्ट होगा, कैसे डैमेज होगा, डिस्ट्रक्शन होगा. अभी मल्टीपल स्क्लेरोसिस आपने यू आस्क्ड, राइट? उसमें क्या हो रहा है? नर्वस सिस्टम, ब्रेन से नर्वस सिस्टम कनेक्ट टू ऑल ओवर द बॉडी, मसल्स वगैरह. सो उस नर्वस सिस्टम के ऊपर एक माइलिन शीथ होता है, मतलब इट्स अ काइंड ऑफ अ कोटिंग ऑन द नर्वस सिस्टम, दैट्स कॉल्ड माइलिन शीथ.
राइट.
इट्स मेड ऑफ न्यूरॉन्स. सो मल्टीपल स्क्लेरोसिस में दोस माइलिन शीथ विल गेट डिजेनरेटेड. मतलब आपका ब्रेन से सिग्नल नहीं मिलता है मसल्स को. अभी मान लीजिए, इफ आई एम ए मल्टीपल स्क्लेरोसिस पेशेंट, I am sitting in a chair, I will not be able to get up because of the advance of the disease, क्योंकि brain से signal will come but signal will not reach my muscle to work,
ओके.
क्योंकि वो माइलिन शीथ का ऊपर, आई मीन दैट नर्वस सिस्टम का ऊपर माइलिन शीथ है, वो डिजेनरेट हो चुका है, मतलब डैमेज हो चुका है. सो क्यों, किस कारण से वो डैमेज हो गया, उसको रिवाइव करने के लिए आयुर्वेदा में पॉसिबिलिटीज है. मतलब उस माइलिन शीथ को फिर से हम रीजनरेट कर सकते हैं.
Okay.
So the fundamental difference of Ayurveda and Western medicine में कोई बैक्टीरिया है, वायरस है, आपको एंटीबायोटिक्स देके कुछ देके उसको डैमेज डिस्ट्रॉय करके थोड़ा हेल्प कर सकते हैं. बट
Okay.
किसी ऑर्गन में वीक है, मतलब किडनी वीक है, लिवर वीक है, your pancreas is weak, your nervous system has gone weak, your muscles have gone weak, then उसको रिवाइव करने के लिए कुछ नहीं है.
Okay.
Okay,
Okay.
so that is the main fundamental difference,
All right.
right?
All right.
So
All right.
इसलिए Ayurveda is more relevant and at this
Got
time
it.
in 21st century, क्योंकि we have things to,
Hmm.
revive. For example, let's say when I was in Coimbatore,
Hmm.
AVP, there are other senior doctors. I was quite young at that time in 2000, maybe 8 or 9 period.
Okay.
एक क्रिकेटर है, मतलब था उस टाइम, ही इज रिटायर्ड नाउ, श्रीशांत करके फास्ट बॉलर. द रीजन आई एम शेयरिंग दिस इज बिकॉज इट इज देयर इन द पब्लिक डोमेन, मतलब
Okay.
इट्स देयर इन न्यूज़पेपर्स. इफ यू search in Google Srishant Ayurveda treatment, you will get all those details.
Okay.
Okay,
Okay.
so he had a ligament tear shoulder, because he's a fast bowler, right hand
Hmm.
ligament tear, or some exact diagnosis I don't remember because many years,
Hmm.
but it was a surgical case. Matlab he was supposed to go to Australia for a surgery.
All right.
Okay, but since he's from Kerala and somebody recommended him that why not try Ayurveda, without surgery you can. So he came to AVP in Coimbatore. He was admitted for 1 month. So we
Okay.
did the classical Ayurveda Panchakarma treatments.
Hmm.
So we were able to regrow his ligament, which was damaged. Okay.
Okay.
So उसी तरह बहुत सारे cricketers और sports people, ligament tear, वेस्टर्न साइंस में एक बार लिगामेंट टेयर हो गया तो वो जॉइन नहीं होगा.
ओके तो
ओके,
उनका क्या
दैट
सोल्यूशन
इज द
है एज
फंडामेंटल.
इन दे रिमूव इट बाय सर्जरी मतलब मुझे एग्जैक्टली exactly पता नहीं है मैं तो
दे स्टिच करते हैं, मतलब स्टिच करते हैं उसको.
अच्छा ओके
या सो उसको स्टिच करते हैं, देन दे अलाउ इट टू ग्रो और समथिंग लाइक दैट. सो
ओके
क्योंकि नेचुरली लिगामेंट्स विल नॉट जॉइन बिकॉज दे कैन नॉट जॉइन टुगेदर, क्योंकि बोन इफ यू कीप इट टाइटली दे मे जॉइन टुगेदर, है ना.
ओके
सो लिगामेंट्स थोड़ा मुश्किल है ग्रो करने का, बट
ओके
इट्स ऑल्सो पार्ट ऑफ आवर सेल. लॉजिकली इफ यू सी the food what we are eating, the same nutrition only going to all the cells in the body, मतलब muscles को, ligaments को, tendons को, nervous system को same nutrition only जा रहे हैं. So Ayurveda believes in that, so we can revive those ligaments or whatever tendons damage,
ओके
उसको revive कर सकते हैं through
ओके
proper Ayurvedic treatments.
आयुर्वेदिक प्रैक्टिशनर्स इक्विप्ड टू डू सर्जरी कहीं पे अगर सर्जिकल इंटरवेंशन की जरूरत है हाउ डज इट गो
So the last question, सर्जिकल इंटरवेंशन आयुर्वेदा में बहुत साल पहले आयुर्वेदिक वैद्यस ने सर्जरी, दे वर डूइंग इट.
ओके
इनफैक्ट इफ यू गो टू ऑस्ट्रेलिया और यूके, मेडिकल कॉलेजेस के बाहर एक स्टैचू विल बी देयर, कॉल्ड सुश्रुता फादर ऑफ सर्जरी. ओके, वो
ओके
आयुर्वेदिक फिजिशियन है. अभी इंडिया में आई डोंट नो वेदर दे हैव अ स्टैचू, बट देन वेस्टर्नर्स बिलीव, and understand that he is the father of surgery, right?
ओके
He has written books on many surgeries.
ओके
So उसके बाद 12th century 13th century में slowly the surgical interventions faded away. But now अभी Ayurveda में one particular course, like if you do a post graduation, there is a master of surgery in Ayurveda, but that is very limited to anorectal surgeries like hemorrhoids, piles, and all those,
ओके
but not advanced stages. क्योंकि modern science surgery में बहुत advanced है, so we don't want to go into that route.
गॉट
क्योंकि
इट
आयुर्वेदा का intention है, और मेन थिंग इज टू अवॉइड सर्जरीज, है ना, टू हेल्प यू टू अवॉइड सर्जरी. क्योंकि सर्जरी इज व्हाट रिमूविंग a particular part from your body, most of the time, which is not recommended, because when you remove a body from a part from your natural body, it will not be a same body anymore, right? So only in emergency, like road accident हो गया, कुछ damage हो गया, then we can think of. Otherwise majority of the cases में सर्जिकल इंटरवेंशन हम अवॉइड कर सकते हैं थ्रू आयुर्वेदा. यू
ओके
आस्क्ड अबाउट मल्टीपल स्क्लेरोसिस, है
या
ना. सो ऑल दिस मल्टीपल स्क्लेरोसिस, फाइब्रोमाइल्जिया, SLE, lupus, rheumatoid arthritis, or बहुत सारे Hashimoto thyroiditis, all this comes under autoimmune diseases.
Okay.
ओके, द फंडामेंटल रीजन है ऑटोइम्यून डिजीजेस का
Hmm.
हमारा ओन इम्यूनिटी, योर ओन इम्यूनिटी इज अटैकिंग योर ओन सेल्स,
Hmm.
है ना. सो द रीजन इज इम्यूनिटी इज अटैकिंग यू.
Hmm.
The disease depends on where it is attacking you. If it's attacking your thyroid gland, then you are diagnosed as Hashimoto's thyroiditis.
Okay.
If it is attacking your muscles, then you are diagnosed as fibromyalgia. If
Okay.
it's attacking your nervous system, then it's a multiple sclerosis. If
Hmm.
it's attacking your joints, then it's rheumatoid arthritis.
Okay.
Okay.
Okay. Okay.
So सेम कारण है
For all the
कैंसर को
things.
भी, या इवन
Okay.
कैंसर को भी सेल म्यूटेशन उसको बोलते हैं, सेल मल्टीप्लिकेशन और सेल म्यूटेशन. सो दैट मीन्स द डीएनए इज कंफ्यूज्ड एंड इट इज making the cells to multiply more,
Okay. Okay.
right? Like for example, let's say in a simple understanding, I'm giving a
Yeah, yeah,
layman
yeah. Please,
understanding
please.
so that everybody can understand,
Right,
right?
right.
हमारा body में every day new cells will grow and old cells will die. This is normal.
Yeah.
Okay. अभी कार्सिनोमा में क्या हो रहा है, कैंसर और कार्सिनोमा मेडिकल टर्म में, आ, कुछ एरियाज में बहुत ज्यादा सेल्स मल्टीप्लाई हो रहे हैं. मतलब लेट्स से लंग्स में कुछ ज्यादा मल्टीप्लाई हो रहे हैं, देन दैट बिकम्स अ ट्यूमर. इफ इट इज मल्टीप्लाइंग मोर इन द ब्रेन, देन बिकम्स अ ब्रेन ट्यूमर. If it's happening in liver, then it becomes a liver cancer. That means 1,000 cells का एरिया है वहां पे, बट 20,000 cells मल्टीप्लाई हो गया. मतलब there is no space for the remaining 19,000 cells. That becomes a tumor. That's called growth.
Got
है
it.
ना, सिंपल लैंग्वेज में. सो हमारा डीएनए कंफ्यूज होके उसको मल्टीप्लाई कर रहे हैं, मतलब फास्ट मल्टीप्लाइंग. उसका कुछ रीजन है, उसको हम रिवर्स करते हैं आयुर्वेदा में.
ओके. ओके. तो हम उसके रूट कॉज पे जाते हैं एंड देन वी ट्राई टू
करेक्ट.
फिक्स दैट रूट कॉज जिसकी वजह से वो सेल्स मल्टीप्लाई हो रहे हैं या फिर हमारी इम्यूनिटी खुद
करेक्ट.
अटैक कर रही है, जिसकी वजह से ऑटो इम्यून डिसऑर्डर्स हो रहे हैं, जो कि अभी मेडिकल साइंस कहीं ना कहीं इस चीज़ को अवॉइड कर रही है या फिर वो नहीं कर रही है इस चीज़ को कि वो अपनी ही बॉडी की स्ट्रेंथ को यूटिलाइज करके उसको रिवर्स करे. कैन वी से दैट?
सो मेडिकल साइंस में अभी मॉडर्न मेडिकल साइंस में एलोपैथी में उसका कॉन्सेप्ट है, वेन एवर देर इज ए ऑटोइम्यून कंडीशन, वो इम्यूनोसप्रेसेंट्स देते हैं.
ओके.
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 thinking that thinking that immunity is behaving weirdly or hyper,
ओके.
but technically it is wrong, क्योंकि आपको इम्यूनिटी को सप्रेस नहीं करना चाहिए. यू कैन इजीली गेट अनदर इन्फेक्शन, राइट, बट दैट इज द ओनली सॉल्यूशन दे थिंक. मतलब कोई अदर ऑप्शन
ओके.
नहीं है. वो
ओके.
भी काम नहीं करेगा. It's not a solution, otherwise so many multiple sclerosis or fibromyalgia or rheumatoid arthritis patient you will not see. अभी आयुर्वेदा में वी हैव अ प्रॉपर अंडरस्टैंडिंग ऑफ द ह्यूमन बॉडी. पहला, ह्यूमन बॉडी कैसे काम करता है, कैसे फंक्शन करता है, उसके लिए प्रॉपर थियरी है, प्रॉपर अंडरस्टैंडिंग है हमारा टेक्स्ट बुक में. सो वंस यू अंडरस्टैंड द नॉर्मल बॉडी क्या है, उसके अंदर क्या हो रहा है. फॉर एग्जाम्पल लेट्स से यू आर सिटिंग एंड टॉकिंग, आई एम सिटिंग एंड टॉकिंग. हमारा बॉडी क्या, वी आर सिटिंग क्वाइटली कामली, राइट, देयर इज नो
राइट.
एक्शन हैपनिंग, राइट. बट बॉडी के अंदर it's not calm. There's lung, heart pumping, blood circulating, lungs moving, intestines are moving, so many hormones are moving here and there. So body के अंदर so many things are working. It's not a standstill body, right? So वो कैसे काम कर रहा है according to Ayurveda? We understand the body based on the five element theory:
ओके.
air, space, fire, fire, air, space,
अर्थ.
fire,
अर्थ.
earth, and
विंड. विंड.
yeah, air and space is vata,
ओके.
fire
ओके.
and water, yeah, fire and water is pitta, and earth and water is pitta. So these are kapha. These are the five elements.
ओके.
So
ओके.
this five element theory uh, is the base of our body. Like our
ओके.
body is made up of five elements. Without these five elements, we cannot survive. We cannot. So all five elements are there in our body. Like physical structure, what you see is earth. Okay, we have water also. We have fire, Agni, digestive system. There is acid secretion and also that's fire. We have air also inside the body, and we have space. Space is nothing but wherever there is emptiness, there is space.
Got
right?
it. Got it.
So this is how we understand the human body. So these five elements derive into three functional elements called Vata, Pitta, and Kapha.
Okay.
Okay. So these three functional elements have certain functions in our body. So
Okay.
उस वो नॉर्मल फंक्शन में बॉडी हेल्दी है, उसमें कुछ इम्बैलेंस हो रहा है, देन इट बिकम्स ए इम्बैलेंस बिकम्स ए डिजीज. सो उसको हम ट्रीट करते हैं. Yeah.
इसमें मुझे थोड़ा सा एक चीज़ बताइए. आई मीन देर आर अ लॉट ऑफ डिफरेंट साइंसेस. जैसे कि देर इज़ वन थिंग कॉल्ड एज चक्रास. आपकी बॉडी में चक्रास होते हैं अलग अलग पॉइंट पार्ट पे, एंड इफ दोज चक्रास आर इम्बैलेंस्ड तो कहीं ना कहीं हमारी डिजीज मैनिफेस्ट होती है. तो ये सारी ये फिलोसफीज अलग होती हैं, या ये भी हम आयुर्वेदा में इम्बाइट करते हैं, या ये भी चीज़ एक ये दिस इज बिकॉज अ पार्ट ऑफ एनर्जी मेडिसिन आई थिंक.
So this energy medicine, Reiki, chakras, few other things are there. They are not exactly part of Ayurveda क्योंकि उस सिस्टम्स में बहुत सारे डीपर अंडरस्टैंडिंग नहीं है एवरी डिसीज को मैनेज करने के लिए.
ओके.
ओवरऑल कुछ जनरल एडवाइस दे सकते हैं, बट लेट्स से इफ यू गो विद मल्टीपल स्क्लेरोसिस और फाइब्रोमाइल्जिया और कैंसर और डायबिटीज और लेट्स से IBS irritable bowel syndrome or ulcerative colitis or asthma or wheezing, then they cannot be able to help you on that. Like we have acupuncture, acupressure, बहुत सारे systems हैं. I can
राइट
say
राइट राइट.
those are all complementary, but
ओके.
it's not a full-fledged medical system like Ayurveda.
गॉट इट गॉट इट. जो आजकल इतनी बीमारियां बढ़ रही हैं, डू यू थिंक क्या उसका एक रीज़न ये भी हो सकता है कि बिकॉज एलोपैथी इज नॉट कंसिडरिंग एज अ होल सिस्टम, और अब एक स्पेशलाइजेशन वाली चीज़ आ गई है कि अच्छा अब लिवर के लिए तो लिवर डॉक्टर है, किडनी के लिए तो किडनी डॉक्टर है, एंड दैट्स वाई दे डोंट फोकस ऑन दी अदर पार्ट्स ऑल्सो जो शायद उस बीमारी को क्रिएट कर रहा है. फॉर एग्जाम्पल किडनी डिजीज माइट हैपन ड्यू टू सम साइकोलॉजिकल इशूज आई थिंक. आई डोंट नो वेदर आई एम राइट टू से दिस, बट क्या फुल बॉडी को कंसिडर ना करने की वजह से जो आयुर्वेदा कर रही है, क्या इस वजह से आज बीमारियां आपको लग रहा है कि बढ़ रही हैं इतनी तेजी से?
Yes, you are right on point. So क्योंकि डिफरेंट सिस्टम्स हैं मेडिकल सिस्टम में, दे गो इनटू लाइक फॉर एग्जांपल pulmonologist, neurologist, gastroenterologist, gynecologist, like that, right? So we think that is specialization, but that is also a problem क्योंकि body is a single unit, body don't have any compartments, right? So one area का problem will not affect the other area too. For example, let's say you said about psychological issue for kidney, right? So पहले 1970s and 80s में there is something called psychosomatic disorders. Okay. अभी डॉक्टर्स उस टर्म नहीं यूज कर रहे हैं क्योंकि those times they used to think that only some diseases mind has a role or psychologically it's affecting you. Stress, anxiety, depression will create some diseases. Those are called psychosomatic disorders. Now this term you will not hear from anybody क्योंकि every disease has an involvement of mind. They realize that after so many years of this is what Ayurveda has been telling for 2000 3000 years. So without the involvement of mind, no disease will come in our body. इसलिए modern psychiatry भी if you see, patients who are having depression, schizophrenia, those kind of conditions, वो medicines बहुत साल तक लेते रहते हैं, मतलब 20 years, 10 years, 15 years. So they'll be on medication for life, right? क्योंकि the understanding of human mind, हिंदी में we say मन, संस्कृत में मनस, that
मनस.
is not clear in the modern science. क्योंकि there is no entity called mind. No, we cannot scan and show this is what your mind. So there is an advantage and disadvantage in that understanding. इसलिए yes, you are right. बहुत सारे diseases अभी people are suffering with no solution is because there is a modern science actually has come to a saturation and end point, or you can say they have hit a wall. Beyond that, there is nothing they can do. Okay, so they are managing with whatever is there. Like during COVID also. मैंने एक्चुअली दिल्ली, मुंबई, बैंगलोर बहुत सारे पेशेंट्स को इवन इन आईसीयू we were able to save from in ICU. Many doctors actually cooperated. It's surprising that normally many doctors don't believe in Ayurveda, matlab they say it's a pseudoscience or whatever, right? Many because of lack of knowledge and ignorance. But since it was an emergency situation, the patients want to try anything they want. For example, in Delhi, I had few cases where the doctors told the parents and the family members has to write a letter saying that we are trying Ayurveda on our own risk. If anything happens to the patient, we are not responsible, right? The hospital is not responsible. उसके बाद हमने Ayurveda medicine we started in the ICU and we were able to save few patients.
Okay.
So they were open for it and they understand that it helps. But how it helps, what kind of theories understanding we have, what is our understanding, that they are not very clear. But फिर भी बहुत सारे researches have been done on this during COVID also. Around 150 patients. Ayush has funded a study in Chennai, in the government hospital. We did a study on on serious COVID patients, and almost 90% of them were saved through Ayurveda, and it's been published also to the government.
Okay.
But due to various reasons, it was the government couldn't take the decision to actually. Now, yesterday I saw a video. Our Chief Justice of India, DY Chandrachud, so he inaugurated Ayush department in Supreme Court. Okay,
Wow.
so Supreme Court of India, and he was telling about how he follows Ayurveda. He has done Panchakarma before, and
Okay.
then he said during COVID time when he had COVID, Prime Minister Modi called him and told him to contact one Vaidya in the government, Ayush department. So they sent medicines to him, and then he recovered from that. So individually they were able to do it, but publicly they couldn't announce it because we are coming under ICMR guidelines, WHO guidelines. So as a country, we are not able to do that. Actually, we could have done it. We were able to do demonetization. We were able to do many things. We could have actually done it. That first line of treatment for COVID is Ayurveda. We could have done it actually. We will be able to save many people. Anyway, it is a different subject
Yeah.
altogether. But emergency maybe Ayurveda helps, very, very quickly.
ये एज अ साइंस आई मीन डू यू थिंक क्योंकि यू हैव अ सर्टेन स्किल सेट इन अंडरस्टैंडिंग द होल बॉडी modern doctors or modern medicine doctors, allopathic doctors, whatever we call them, but they are specialized in certain areas. If we integrate, both these pathies together, तो क्या हम एक अच्छा रिजल्ट अचीव कर पाएंगे? आई मीन विल दिस बी अ बेटर ऑप्शन इन फॉर द फ्यूचर, और डू यू थिंक आयुर्वेदा इज सेल्फ सफिशिएंट टू टेक द न्यू अपकमिंग डिजीजेस जो आज के टाइम में आ रही हैं, अलग अलग नई नई बीमारियां, तो उनको आयुर्वेदा
Very good.
सिंगल हैंडेडली ले सकती है?
Very good question. Actually, my personal, opinion or suggestion is actually to have an integrated approach. Kyunki both systems have good advantage in certain areas and maybe disadvantage in certain areas. Okay. Like for example, if you take the modern medical science or the allopathy, they have good, advancements in, a lot of, equipments and scans and
Diagnostics.
life-saving things. Yeah, diagnostic life-saving things. Like if you have an heart attack, they can save you. If you had a stroke, they can actually take care of that particular, time, right? Accident and all those. Uske baad, once they manage the emergency, for example, let's say somebody had a stroke, cerebral stroke, right? Paralysis. The blood clot in the brain, and then the person goes into, paralysis attack where one side of the body can become, no strength. They cannot walk. Speech can get affected, right? Example I'm telling one condition mein. So let's say the family members took him to the hospital and they managed the emergency. Matlab, they have given some things to stabilize and then he is stable. Now, the only option from the modern science what they have is physiotherapy. Okay.
Okay.
So what is physiotherapy? Is basically giving some exercises to help in the muscles. But the problem is the brain is not giving any signal to that hand or leg because the nervous system got affected here. So how much ever you do hand exercise or leg exercise, you will not be able to give the full recovery. Maybe with natural body's recovery, you will get some improvement. But in that time, if Ayurveda is combined, like we have this Panchakarma treatments, that oil treatments plus internal medicines, actually we can revive some cells which are half dead in the brain through Ayurveda system. So they can get revived. So that is how we will be able to combine these both systems. In fact, अभी बहुत सारे you know Western hospitals, allopathic hospitals are open for it. Like Delhi mein Medanta, they have an Ayurveda wing
Okay.
with Ayurveda. Apollo hospitals, Apollo Group, they actually bought a Ayurveda company which is called Apollo Ayurveda now. Ayurveda. So like that, बहुत सारे West allopathic hospital companies भी अभी आयुर्वेदा में interested हैं. So now we have separate ministry of Ayush, independent minister for this. Government also supporting a lot of subsidiaries on Ayurveda wellness retreats. So next 10 साल 20 साल I think it's the time of Ayurveda to
Amazing.
become the you can say, I'm not saying that एक system नहीं होना चाहिए, only one system has to be there, ऐसा नहीं है. Every system has its own space, but if we can combine and integrate is Western approach and Ayurveda in, like I give you example of stroke,
Right.
right?
Right.
So ऐसा integrate कर सकते हैं, it actually is good for the patients.
एंड इसमें डू यू थिंक कि मेडिसिन्स, क्योंकि एलोपैथिक मेडिसिन आर वेरी हार्ड ऑन द बॉडी समटाइम्स, सो उसमें आयुर्वेदा आई थिंक उसको प्रिवेंट करने के लिए भी हेल्प कर सकता है या फिर वो इंटरेक्ट करेगा उससे? व्हाट डू यू थिंक?
Okay, so medicine, when it comes to medicine, Western or allopathic medicines are made in the lab,
या.
chemicals, right? It is not natural to our body. That means your body is not used to those chemicals from the lab. That's why many times we have side effects and things like that. You know?
या.
But if you see Ayurvedic medicines, many times this myth or misconception is there in the public. Okay? Like dono medicine interact hoga, dono medicine may react hoga, that's a very, very big myth. So Ayurveda mein, what we are giving, that's basically plants which are natural, which are accustomed to our body. For example, ginger, garlic, pepper, tulsi, whatever you are actually using in your cooking. Those things only we are giving as medicine. Of course, some extended plants are there, but they are all from nature. That means we are used to nature. From many generations, we are used to nature. Any plant, of course, there are some poisonous plants, but otherwise, if you take any plant and eat it, you are not going to die, right? Because body will somehow digest it. But of course, we have plants which are kind of derived, and then different medicines are made out of it. ये common different है, मतलब Western medicines might create some side effects, but Ayurvedic medicines are not going to create any problems. In fact, most of my patients who are coming to us, they already will have 10, 20 tablets for heart disease, for diabetes, for BP. So usually we don't stop them abruptly. We give Ayurvedic medicines, and then slowly, once they are getting better, we might reduce the dosage, or we might remove
ओके.
certain
ओके.
unwanted medicines. Only keep the important life-saving ones.
ओके. 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 डू यू एडवोकेट, मतलब द यूसेज, डू यू एडवोकेट द यूसेज ऑफ सप्लीमेंट्स? जैसे आपने बड़ा अच्छा पॉइंट बोला ये कि यू गिव तुलसी एंड यू गिव जिंजर, तो अगर उसी के अंदर जो कंपाउंड्स है उसी को सप्लीमेंट्स निकाल के हाई डोजेस में देते हैं, विच इज़ जिस पे आई थिंक काफ़ी रिसर्च भी हो रखी है, तो
Hmm.
डू यू थिंक कि होल हर्ब इज ऑलवेज बेनिफिशियल टू गिव, और उसके अंदर का कंपाउंड, फॉर एग्जांपल करक्यूमिन इन केस ऑफ टर्मरिक, तो हल्दी देना इज बेनिफिशियल, और even curcumin is more beneficial because it's the extracted part of that which has potentially more healing benefits?
Okay, good question. So Ayurveda mein, when we give a herb or when we give a medicine, uh, in the concept of each action of the medicine is not the extract or the active principle of that plant,
Okay.
which was not the because 2000 years ago there was no active principle or extract of the plant,
Exactly.
right? So when we make a khada or a lehem or a kashayam or arishtam or whatever, so we are giving based on the guna of the herb. Matlab, whether it is a hot property or a cold property, whether it's a moisturizing property or a dry property, those are called gunas in
Okay.
Sanskrit, meaning the quality or the action,
Nature.
or we call it as virya. Virya means action
Okay.
of the herb in the body.
Okay.
Okay, so that means there are certain methods उसमें वो कैसे prepare करना है, वो सब है, proper preparation वगैरह, there is a guideline on that.
Okay.
But when it comes to supplements, like for example curcumin, turmeric, right? So supplements, many times people think, misunderstand that also as Ayurveda. Okay, just because it is coming from a herb extract, it does not carry the Ayurvedic principle.
Okay.
Okay, it is not harmful to our body, but
Okay.
it may not work in the same way how the Ayurvedic herbs are working in diseases.
Okay.
But when it comes to supplements, for example, let's say, you know, vitamin C, which is proven in many studies that high doses of vitamin C can help in fighting the free radicals and minimize the cancer effect and things like that, right?
Right.
In some cases, they try through drips, vein, and all those. So उसमें मैं believe करता हूँ, क्योंकि
Okay.
if you combine this like natural organic supplements, I actually created a separate system called antioxidant therapy, which
Okay.
is one of my area of strength in autoimmune disease. In
Okay.
2012, I started this after reading certain research papers and all. So when I combined classical Ayurveda and antioxidant therapy, the results were very fast and the results were much better.
Okay.
So इसलिए we have to evolve, we have to adapt to certain things. Yes, I'm a traditional pure Ayurveda physician, but there is no harm in giving a herbal supplement like a vitamin C from acerola cherry or Indian amla, gooseberry,
Got it.
or
Got it.
garlic pills, things like that. So as long as it is from plant source, as long as it's natural, I have no issues on that.
Got it.
Or
Got
we,
it. Got it. तो ओवरऑल आई मीन थ्रू द नेचुरल अप्रोच वी कैन से कि हम पेशेंट को बेनिफिट पहुंचा सकते हैं, तो वी कैन एंड द टाइम्स आर चेंजिंग, मॉडर्न होते जा रहे हैं थोड़ा, पेशेंट्स आर ऑल्सो समवेयर कंफर्टेबल, उनको लगता है कि अच्छा ये है चीज़, वाइटामिन सी एग्जिस्ट करती है, पीपल आर टेकिंग मल्टीपल मल्टी दिस व्हाट यू कॉल दिस वाइटामिन
multivitamins.
सप्लीमेंट्स, मल्टी वाइटामिन्स, या सो
Yeah,
कहीं ना कहीं शायद all these things will definitely help them. Coming to your strength, आपने बड़ा अच्छा एक point बोला अभी, I mean you have 20 years of experience, तो आपने ऐसे कौन कौन से cases देखे हैं जो you can say allopathic science कहीं ना कहीं they have failed, या फिर आप ऐसे बोल सकते हैं कि उन्होंने वो चीज़ पे गिव अप कर दिया था, इन समवेयर दे केम टू यू एंड यू वर एबल टू हेल्प द पेशेंट? कोई ऐसे केसेस आपको मिले हैं अपनी लाइफ में?
बहुत सारे. Actually, allopathic system fail as a, I won't say, it's basically they are not able to give solution, क्योंकि उस system has certain limitation to understand the body, right? इसलिए
राइट.
most of the lifestyle diseases, they don't have any proper solution, है ना?
ओके.
अभी multiple sclerosis में, मैंने 2-3 patients को, bedridden patients को, I was able to help them to walk
अमेजिंग.
with classical Ayurveda and antioxidant therapy combined
ओके.
करके. Fibromyalgia, I have many patients where they were able to live a normal life. Rheumatoid arthritis, there are many patients, with the severe joint swellings and inflammation and things like that. उनको मैंने actually almost normal किया है, many cases में. और surgeries like ligament tear in knee, some cricketers like club level cricketers and all, I was able to help them to actually avoid surgery and revive the ligaments.
ओके.
और autoimmune diseases में of course बहुत सारे काम मैंने किया है. और कोविड में 2021 peak of delta, right? 2021 April, May, June, I was extremely busy treating 30-40 patients a day, through audio video calls. So COVID में एक बार one thing I wanted to actually give clarity how I was able to help,
Yeah.
right? So all Ayurveda doctors, my colleagues and all, they were all thinking about COVID virus, COVID-19 हो spread हो जाएगा. So they were not actually going near any patient, or they thought there is no treatment in Ayurveda. क्योंकि they were thinking in COVID-19 virus. So I studied the symptom. Okay. This is how a good Ayurveda physician has to look into any disease. It's a very simple understanding, right? What is the symptom of COVID? High fever, initially cough, cold, congestion, and then the seriousness or the life-threatening situation is the lungs gets fibrosis. That means the lung internals, the small cells gets fibrosed. So the patient is not able to breathe oxygen. It will not go inside the system. That is a complication. So what Western doctors were trying to do, they were trying to admit them in ICU and then give oxygen supply or whatever, You are giving oxygen supply, but the lungs are not ready to take that because there is no space in the lungs. It's completely fibrosed. Okay.
Okay.
So that's called kapha, the place of kapha. We call it as kapha dosha or kapha utkleshana. So I did not think it as a virus and all those.
Okay.
I only thought, okay, there is a kapha utkleshana. Kapha is getting blocked. So we have medicines in Ayurveda where we can actually open those channels. So I combined those herbs and kind of did a combination, my own combination, and then started giving sip by sip to patients in ICU every 15 minutes, two to sips. So from oxygen 85 in 24 hours, 48 hours, the oxygen went to 95 because
Amazing.
the lungs were opening up. I have recorded, things in photos and even the CT scan and all those from different patients. So easily, I was able to help. So it's not like, there's some magical remedy. It's a very simple understanding of the human body. Going back to fundamentals. See, whenever there is a confusion, we always have to go back to fundamentals, go back to basics.
Right, right. So just wanted to understand one thing here, that they chose Ayurveda as the first line of treatment, those COVID patients.
Some of them, like
Okay.
some of them who did not actually got an admission because, peak 2021, April, May, June, many hospitals were not having any beds. As you
Okay.
know, in Delhi also, people were on the streets, road, everywhere. So many were forced to look for options outside.
Okay.
Since, I did not advertise it in a big way because, there was no
Right.
this thing that time I was actually not independent. I was in a brand, so I cannot actually, I was working for some brand, so I cannot independently do it. But through word of mouth, many patients approached me, and that's how I was able to, treat. For example, let's say if I treated somebody in the family, then the other family members,
Okay. They
because everybody
also.
is affected, right?
Yeah.
So they all will come. So that's how there are a lot of people, it was first line of treatment.
Hmm. Got it. Got it. So, how helpful is Ayurveda in treating diseases like, asthma or diabetes, BP, cancer? What do you think about it? I mean, if people specifically choose as the first line of treatment.
You have mentioned some 4 or 5 diseases. Everything has different
In a general
causes.
outlay. Yeah, yeah, in a general
Yeah,
outlay. I mean,
yeah.
you must have come across some cases. तो इनमें से ऐसे
Hmm.
कितने केसेस हैं जो कि डू यू थिंक कि आयुर्वेदा एज अ फर्स्ट लाइन ऑफ ट्रीटमेंट इज वेरी हेल्पफुल, और वेयर यू हैव सीन एक्सेप्शनल रिजल्ट्स?
See, with my experience in 20 years, I would say almost every disease Ayurveda can be the first line of approach if if the patient is able to find a good Ayurveda physician, okay, who is well versed in the science. Unfortunately, that's a problem. So one of my mission in my career, apart from founding this Ayuraksha, and then going to start the wellness retreat, is to also actually to train and help upcoming Ayurveda physicians to be more clear and stronger in the field of Ayurveda, so that will spread into proper fundamental approach and knowledge, right?
ओके.
Like if let's say diabetes, okay. So diabetes, we have two varieties. One is type 1 and then type 2. So you'll be surprised that type 1, where there is no insulin in the body, that means it's called insulin dependent diabetes mellitus. That's called juvenile diabetes. We even young children, who are diagnosed with diabetes, like 5 years, 6 years, 7 years,
Mm-hmm.
with Ayurveda approach, with Ayurveda medicines, they were able to, revive back and come back to normalcy where the pancreas started producing insulin. Okay.
Okay.
Not everybody will come to us, but whoever has come to me, I was able to do that. So type 2 diabetes, again, the insulin is secreting, but it's not enough to metabolize the glucose. So
Okay.
in those times, in those situations, type 2 diabetes, if the patient is willing to follow the strict diet, physically and mentally, whatever we recommend, we can still actually help the patient to come out of insulin if they are on insulin, or reduce the dosage. In some cases, with proper Ayurveda and yoga approach, they can
Okay.
even completely come out of the type 2 diabetes mellitus. Okay.
Amazing.
The what's the other thing you asked? Diabetes and
Diabetes, cancer, if you say.
okay. So cancer is again a little different area altogether. It has a lot of stress factor involved. Mind is involved. If they come to us in stage one, definitely we will be able to help them a lot. But if they come to us in stage two or stage three, still we will have a much better option than a chemotherapy or radiotherapy. But here again, very few people will come to us because of the
Mm.
uh, faith level, because we are not in a very sophisticated, what do you call, big five-star hospitals yet. Of course, we will come up with that project very soon, maybe in 1 2 years. That's the reason, so yes, stage one, if they come to us, definitely we will be able to give them a lot of hope.
Amazing, amazing. And how about BP and, I think just BP only.
So blood pressure, if you see, there are two reasons. One is heart related. There is a definitely a heart problem, and then there is a lifestyle related, like stress related, obesity, other reasons. So if it is heart related, then we have to see what is the root cause, which is causing the blood pressure to go high. But majority of the BP patients in the society are mostly lifestyle related, stress
Okay,
related. Maybe sleep is not good, they have anxiety, stress, or maybe uh, you know they have obesity and things like that. So once we correct this reason, the fundamental reason why the blood pressure is high, like I had patients where when they get admitted into our retreat, the BP, let's say 150 by 100. Okay. Maybe because of the lifestyle and all those issues. So by the time we discharge them, let's say after 14 days, 15 days, the blood pressure is 110 by 70. And I did not give any medication to BP though. Okay. We don't have any medication to BP directly in Ayurveda, because blood pressure was not mentioned as a disease long back, because there was no BP, machines. So blood pressure is only a recent understanding, or you can say in the last 50, 60 years of understanding. So once we, help the patient to sleep better, reduce stress and help him digest better, then the blood pressure became normal. So 90% of the time, the blood pressure can be related to lifestyle and stress related, which can be completely cured. But if it is
okay,
heart related, then we have to go to the root cause and then help them.
okay, okay. So heart related, you mean heart attack, preventing heart attacks and something of that sort?
No, heart related meaning there may be a valve issue,
Okay,
heart valves might not be functioning properly,
okay,
or maybe there is a pacemaker issue.
all
Okay, so
right,
that can vary the BP, or maybe there are blockages in the arteries of the heart, which can lead to heart attack later, but there may be mild blockages. Okay,
okay,
so
got
though
it.
I'm talking about the structure wise, anatomically there is a problem in the heart.
All right, all right, all right. Uh, do you think all these diseases they can, so the approach that you take specifically is how does it go? I mean, in treating all these, in diagnosing all these diseases.
So in Ayurveda, we have something called Hastasthana Pariksha. That means 8 methods of diagnosis. Okay.
Okay,
By looking at the patient, by asking questions, by looking at the tongue, by checking the pulse, by asking about their sleep, their digestion, their appetite, their bowel movements. These are important areas of diagnosis. Okay.
okay,
So modern medicine or modern approach, is based on the investigations, blood report. We also use those because that is a
Okay.
scientific technology that's not related to one
Right, 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 right,
medical
right.
science, right?
Right.
I can use an MRI if there is a need. I can use a CT scan if there is a need. But generally, I don't do it because our diagnosis is very clear. And if the patient is coming with a report,
Report.
then that also will give me some idea
Got it.
about
Got it.
what exactly it's happening. So most of the time, we use Ayurveda's fundamental 8 methods of diagnosis.
ओके सो ये इन पर्सन उसका प्रेजेंट होना ज़रूरी है या फिर वी कैन ऑल्सो डू दिस इन वीडियो कंसल्टेशंस.
वीडियो कंसल्टेशन काफी है नाउडेज विद टेक्नोलॉजी. वीडियो कंसल्टेशन में क्या है ना, इस इवन इन दिस 8 मेथड्स ऑफ डायग्नोसिस, उसमें ज्यादा यूज करने वाली चीज है आस्किंग क्वेश्चंस.
ओके.
बाय आस्किंग क्वेश्चंस वी नो व्हाट इज द imbalance happening in the body, so that is enough to actually diagnose the condition and treat.
ओके.
So through Zoom, through WhatsApp, anywhere
ओके.
in the world, I have patients all over the world in multiple
ओके.
countries.
ओके. ओके.
So I treat because everybody I cannot tell them to come to Bangalore, right?
राइट, राइट, राइट.
So we can treat remotely.
ओके. सो
कोई
ये
प्रॉब्लम नहीं है.
मतलब जो भी आप डायग्नोसिस करते हैं ऑन द बेसिस ऑफ क्वेश्चंस यू देन आप उसको फाइनली यू ट्राई टू एसेस कि वो वात या फिर पित्त या फिर कफ डोमिनेंट है, इन तीनों में से कोई डोमिनेंट है. हाउ डज इट गो.
सो ये वाता पित्त कफा में दो एंटिटी हैं. वन इज कॉल्ड प्रकृति, मतलब वी आर born with that combination
ओके.
when we are conceived in our mother's womb with egg and the ovum and the sperm. उस टाइम पे आपका कॉम्बिनेशन फिक्स्ड है, मतलब यू कैन बी अ वाता प्रोडोमिनेंट और अ पित्ता प्रोडोमिनेंट और अ कफा प्रोडोमिनेंट. इट्स अ कॉम्बिनेशन दैट्स
ओके.
कॉल्ड प्रकृति, मतलब योर बॉडी कॉन्स्टिट्यूशन विच विल नॉट चेंज until your
ओके.
death. The other entity is called Vikruti. Opposite of Prakriti is Vikruti. Vikruti means imbalance or disease.
ओके.
So that imbalance can come due to lifestyle and other issues, digestion and all those. So हम आयुर्वेदा में उस imbalance को balance करते हैं.
गॉट इट. गॉट इट. तो यही इम्बैलेंस हम मतलब हर बीमारी में ये कहीं ना कहीं इम्बैलेंस रहेगा ही रहेगा, चाहे वो बीपी हो चाहे
Correct.
डायबिटीज़ हो. किसी ना किसी वजह से या तो वो वात डोमिनेंट होगा या पेट डोमिनेंट होगा, डिपेंडिंग ऑन द डिजीज.
करेक्ट. वही हम ट्रीट करते हैं, इसलिए मैंने बोला है वी डोंट ट्रीट द डिजीज, वी ट्रीट द इंडिविजुअल. सो उस इंडिविजुअल में क्या इम्बैलेंस है उसको हम बैलेंस करते हैं.
ओके. ये अब मुझे बहुत आई थिंक व्यूअर्स को भी ये क्वेश्चन होगा कि कुछ डिजीजेस के लिए क्या ये मेंशन ही है कि ये वात डोमिनेंट, मतलब ये वात का ही इम्बैलेंस होगा या फिर ये पित्त का ही इम्बैलेंस होगा. फॉर एग्जांपल अर्थराइटिस, इफ आई एम सेइंग कि इफ अ पर्सन, तो ये कैन वी से कि ऑल आयुर्वेदिक फिजिशियंस विल डायग्नोस अर्थराइटिस एज द सेम इम्बैलेंस, या फिर ये हो सकता है कि आपका जो डायग्नोसिस है वो किसी दूसरे आयुर्वेदिक फिजिशियन से अलग हो.
दिस इज द मोस्ट डिफिकल्ट थिंग इन आयुर्वेदा, क्योंकि अलग अलग आयुर्वेदिक फिजिशियन, सी द द फंडामेंटल्स आर क्लियर, द बेसिक्स आर क्लियर, everybody studies the basics, right? But how you apply that basics into the body is where the challenge comes, है ना? So बहुत सारे आयुर्वेदा physicians who are treating ayurveda, majority of them they diagnose through allopathy or western medicine and then try to give ayurvedic herbs.
ओके.
Okay, for example, let's say you are coming with diabetes.
ओके.
If I am a ordinary ayurveda physician, 95% doctors in India, unfortunately, I will say, okay, diabetes, insulin. Okay, what's your sugar level? Okay, fasting sugar this much, HbA1c this much, all those things. Then I will be giving medicines to reduce the sugar. I will be giving maybe curcumin or some madhumardhan, or some diabecon. Some lot of Ayurvedic diabetes medicines are available in the market. They're called
ओके.
patent medicines.
ओके.
Okay. Then I may tell you also to do some exercise, lose some weight or whatever, all those things. Okay.
ऑल राइट.
So if an allopathic physician also giving medicine to reduce sugar, and I am also giving medicine to reduce sugar as an Ayurveda physician, and I call it as I'm natural physician, I'm herbal physician, I'm giving natural medicines to reduce sugar. That means I don't know my science properly.
Okay.
Okay, because a good Ayurveda physician will diagnose diabetes as Madhumeha. Okay, and what's happening in Madhumeha? Not only giving the Sanskrit word, what is exactly happening in Madhumeha? In Madhumeha, in the beginning stage, the reason why the Madhumeha is coming is Asya Sukham, Swapna Sukham, Dadini. These are Sanskrit words that means sitting and doing job, always sitting, taking milk and milk products, mainly curd, which is dangerous actually, and no exercise. That increases kapha in our body, the kapha
Okay.
dosha. So those increased kapha will go and block the urinary system, okay, and
Okay.
not allow the the bladder, the pancreas to start functioning properly. The insulin will not produce properly. The insulin will not produce properly. So that way there is no metabolism not happening properly. The cells are not taking the glucose properly,
Okay.
okay, or the cells are rejecting the glucose, insulin resistance syndrome, because they have enough glucose already. We are oversupplying it. So that is the first stage, lot of kapha, that's why the patient might feel tired, drowsy, most of the time, and then excess urination happens. Night time they go for more urine. These are the initial beginning symptoms, and they feel thirsty all the time. Then later stages, it will become more vata. That means a lot of kapha will go out of the body. They lose a
Okay.
lot of good kapha, and then it becomes more vata. So, as a Ayurveda physician, I will be managing this vata imbalance and the kapha imbalance,
Okay.
not reducing sugar by giving herbal medication to reduce sugar.
Okay. Okay. Okay.
It's a huge difference, by the way. I don't know how you are able to get it.
या आई मीन ये तो थोड़ा सा मतलब मुझे लगता है शायद आयुर्वेदिक फिजिशियंस बेहतर समझ पाएंगे बट इन जनरल डू वी हैव सम टूल्स वेयर अदर देन द ब्लड रिपोर्ट्स एंड यू नो जो हमारे डायग्नोस्टिक हैं क्या आयुर्वेदा में भी ऐसे टूल्स डेवलप हो चुके हैं या हो रहे हैं जो कि आपको असेस करके बता सकते हैं कि आपकी बॉडी में ये इम्बैलेंसेस हैं as in from the ayurvedic perspective, not from the blood report perspective.
Yes, that's what मैंने अभी बोला है, right? By applying the Ashtasthana Pariksha, 8 methods of diagnosis, we can
Okay.
clearly say what stage, how serious is the diabetes,
Okay.
how much,
Okay.
internal organs got affected. Yeah,
Okay.
वो सब हम बोल सकते हैं.
Okay, नहीं my no what I wanted to ask was कि through blood निकाल के आपको पता चल गया कि अच्छा इसका इसका ये imbalance है something of that sort this
Mm-hmm.
dosh is more prominent than the other dosh थ्रू
Hmm.
रिपोर्ट्स और थ्रू प्रेशर ब्लड प्रेशर से और ये सब इन्हीं जो आपकी विधि है उसमें आती हैं सारी चीज़ें.
No, we don't use that as a understanding or a study,
ओके.
क्योंकि हमारा system clear है by asking this all these 8 methods of diagnosis.
गॉट इट.
उसमें clear है that this is the imbalance.
Got it, got it, got it, got it. And now, how do you, whenever someone comes, so you are saying that you first diagnose the patient, आप इन सब के basis पे आप diagnose करते हैं, and then you start giving a diet or a lifestyle change, or you give medications along with that. How does it go?
इट्स अ कॉम्बिनेशन ऑफ एवरीथिंग, है ना, क्योंकि अभी ये डिजीज और कंडीशन वट एवर हेल्थ पेशेंट्स आर हैविंग, इट इज नॉट ड्यू टू वन रीजन. लाइफस्टाइल रीजन भी हो सकता है, डाइट का प्रॉब्लम भी हो सकता है, स्ट्रेस फैक्टर भी हो सकता है. सो वी हैव टू करेक्ट एड्रेस एवरीथिंग. सो फूड इज मेडिसिन, ये एक्चुअली आयुर्वेदा में वेरी क्लियर है दैट फूड इज मेडिसिन. वेस्टर्न साइंस में वो क्लियर नहीं है. दे कैन गिव यू, let's say if you go with the skin disease, they'll tell you you can eat chicken, mutton, beef, whatever you want to eat, you can eat.
Hmm.
But if you ask any old people that you have skin problem, you have to avoid non-veg first. If you have
Got it.
wheezing and asthma, you have to avoid curd or milk products. These are common, right? But Western science में वो उसको probiotic बोलते हैं. You
Right,
can take
right, right.
yogurt, there is no problem. But if you ask your grandmother, she'll tell you if you have fever, you cannot take curd. If you have wheezing asthma, you cannot take curd. Why? Because it can aggravate more kapha. So नहीं है. So इसलिए we actually help them in changing the diet and giving some herbs. In some cases where the doshas are beyond the control of the medicines, that time we have to admit them in panchakarma, for panchakarma.
Okay.
मतलब In a simple language, you can call it as Ayurveda detox cleansing programs. There are five methods we use that's called Panchakarma. So each method is for different dosha imbalance. So
Okay.
उसका जरूरत होगा if the disease is beyond the control of the medicines.
So is Panchakarma hard on the body?
नहीं नहीं Panchakarma is never what do you call more difficult process to go through,
Okay.
right?
Okay.
So it should be comfortable for the patient.
All right. All
So
right.
we do it only what is necessary for the patient, and
Got it.
it's not recommended for everybody. We can only do it above 15 years or 18 years of age until probably 65, 70 tak. After that, we cannot do the Panchakarma because the body may not be strong enough to go through. Meaning it's not a very serious kind of issue, but then the recommendation is up to certain age period only.
सो जनरली अगर मैं आपसे प्रिवेंशन की बात करूं तो कैन आई टेक पंचकर्मा क्योंकि इट्स अ 5 स्टेप प्रोसेस फॉर डिटॉक्सिफिकेशन ना. सो क्या मैं प्रिवेंशन के लिए एक पंचकर्मा अपनी लाइफ में रेगुलरली अप्लाई कर सकता हूं सो दैट आई
Yes,
स्टे हेल्दी एंड आई बी फ्री ऑफ डिजीजेस.
यस मैं उसको रेकमेंड करता हूँ क्योंकि इट्स लाइक सर्विसिंग द कार, राइट? लेट्स से यू हैव अ कार, यू डोंट गो टू द सर्विस सेंटर ओनली when it's having a problem. There's something called regular service, right? You change the engine oil, you change the air filter, you change the AC filter, you change the brake shoe, you change this. So क्योंकि there is a wear and tear happens in a machine. Body is also a machine, right? We are eating food, we are doing a lot of activities. So there is wear and tear happening on daily basis. So this Panchakarma cleansing or detox programs can minimize those effect. So if
ओके.
somebody can do yearly once, 3 weeks program,
ओके.
I would say
ओके.
they can avoid many serious health problems in the future.
ओके. सो इट्स अ 3 वीक स्टैंडर्ड प्रोग्राम मतलब ये ऐसा ही होता है.
2 weeks also we can do 14, 15 days,
ओके.
but if they have time, I would say 21 days. Otherwise, 14 days is also good enough. So I have, people who comes every year to treatment, like some of them 5 years, 10 years, they come regularly. So they have a kind of a principle in life that out of 365 days, they work hard 340 days. 25 days, they give it to the body and mind.
ओके.
That's their fundamental.
Okay, okay, okay. Amazing. So you also have been in touch with a lot of celebrities. मतलब आप अर्चना पूरन सिंह, श्रद्धा कपूर, कपिल शर्मा इन सब के साथ भी आपने काफ़ी काम किया हुआ है. So ये सब कैसे
Right.
how did you get in touch with them? मतलब सबसे पहले तो they require Ayurveda as a they practice Ayurveda as a general thing in their life, or how does it go?
So basically, if you see, बहुत सारे सेलिब्रिटीज आयुर्वेदा को फॉलो करते हैं. मतलब दे गो समवेयर, इट नॉट टू मी, देयर आर मेनी प्लेसेस इन केरला दे माइट टेक. So, like Akshay Kumar ji, he actually propagates Ayurveda, and he has videos in YouTube where he is talking about Ayurveda, है ना? So उसी तरह एक वीडियो कपिल शर्मा ने देखा था. मतलब ही इज माय गुड फ्रेंड नाउ. सो
Okay,
उन्होंने इसी तरह एक वीडियो देखा था, लाइक somebody showed him. So he had some health concern. So उसके लिए डिटॉक्स पंचकर्मा करना था. So that's how he approached me through online searching करके. सो
okay,
2017, 2018, 2 साल मैंने उनको ट्रीट किया था बैंगलोर में. ही
hmm,
हैड सम कपल 2 weeks प्रोग्राम. उसके बाद उनके थ्रू अर्चना पूरन सिंह जी भी आए थे, देन शक्ति कपूर जी, देन श्रद्धा
okay,
कपूर एंड फ्यू अदर सेलिब्रिटीज. और
okay.
सलमान खान को भी मैंने एक्चुअली फोन पे ट्रीट किया था, बट
अच्छा.
ही डिडंट कम टू बैंगलोर. लाइक
Okay.
फोन पे कंसल्टेशन में किया था. But once our setup is ready, in 2 years' time, I will definitely bring in, because see, it's not about celebrities also. Like they are a voice where people can have a belief, right? Oh, if
Right,
he is doing it, then it's good,
right,
right?
right, right.
So that's a responsibility. And Kapil has always, he has given videos. He has given. In fact, I had a Insta live with him, which is there in my YouTube channel.
Okay.
So it's very popular in internet. Even Archana Puran Singh also has put in her Insta profile one of my videos. So a lot of celebrities are very open about Ayurveda. So the reach is good because they are connected with the masses. So इसलिए if they can uh, advocate Ayurveda, it will definitely
एग्जैक्टली
reach to
एग्जैक्टली
many people.
राइट 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 रिस्पॉन्सिबिलिटी भी बढ़ जाती है एंड रिस्पॉन्सिबिलिटी के साथ एक मैसेज थोड़ा सा अच्छा रहता है, लोगों तक पहुंचता है, तो मोर पीपल कैन बिलीव हाउ दीज सेलिब्रिटीज आर ऑल्सो टेकिंग अप आयुर्वेदा इन देयर लाइफ, तो वो अपनी लाइफ में भी इंकॉर्पोरेट कर सकते हैं, जो शायद कहीं ना कहीं दे ऑल्सो आर इंटरेस्टेड इन लर्निंग अबाउट दिस, तो
Yeah,
दिस इज अ गुड थिंग. या ग्रेट.
absolutely.
दैट इज लाइक अमेजिंग. अभी बहुत अच्छा था ये. बट ओवरऑल डू यू थिंक आयुर्वेदा आज से आने वाले सालों में ये अब धीरे धीरे, जैसे आज की डेट में इसको स्यूडो साइंस टर्म कर दिया है, ये आपको लग रहा है कि कहीं पे कम होगा या फिर इसका इम्पैक्ट अब बढ़ने वाला है आने वाले टाइम में? व्हाट डू यू थिंक?
Pseudoscience.
हम्म.
As I haven't heard anybody, saying, but
ओके.
anyway, whoever has said that, maybe they have no clue of what is Ayurveda. Maybe ignorance, lack of knowledge. So God bless them. So basically, if you see, the kind of diseases what people are going through nowadays, I can see not only because I'm an Ayurveda physician, but I can see in general as a public, as a common person, that more and more people will search for natural healing or systems like Ayurveda, yoga, things like that. Because our lifestyle is not like 20 years, 30 years, 40 years ago how we
राइट
were.
राइट राइट.
It's becoming more and more stressful, more and more complicated, right? Because of so many things are happening around. So that is creating a lot of health problems. See, we never heard of autoimmune diseases and all 30, 40 years ago in India. Very, very rare. Now, if you see everybody, almost everybody is having some issue, and cancer also. Everybody, somebody in the family, somebody is
या.
dead of cancer, which is
या.
not there, which was not a case many, many years ago. So it's very common sense and it's apt and clear that Ayurveda is going to grow leaps and bounds, and many people will follow Ayurveda. It's not only, see, following Ayurveda is not only going to your Ayurveda doctor and taking medicine. Following Ayurveda is as simple as, you change your food habits, you eat less, you exercise more, and you do meditation, you do yoga, or you sleep better. This itself is following Ayurveda, because Ayurveda, the term itself is Ayu is life, Vedas means principles. So these are, Ayurveda is not only a medical system. These are principles to have a
इन
healthy
लाइफ.
life, to live a healthy life.
दैट्स अमेजिंग. आई मीन बहुत लोग, मुझे लगता है, दे आर स्लोली टेकिंग अप आयुर्वेदा. और जैसा आपने बोला, आज से 10 से 20 साल में मुझे लगता है लॉट ऑफ पीपल, एंड आई थिंक फॉरेनर्स स्पेसिफिकली, इंडिया में तो जो कर रहे हैं, फॉरेनर्स हैव अ डीप बिलीव इन दीज सिस्टम्स, तो वो ज़्यादा फॉलो कर रहे हैं
Yes.
एंड दे आर मोर रिलीजियसली फॉलोइंग इट.
Yeah. Fortunately or unfortunately, more than Indians, a lot of Westerners are following Ayurveda and they're coming to India for it. Even in my, patient circle, if you see, majority of them are from abroad.
इज इट?
From Europe and US and Canada and Australia. So they have more belief because they have seen the end of, or they have seen the limitation of the Western science, and that's
या.
how they're looking for our science.
No, I think overall, the time is ripe, and I think next 10 years and 20 years, I think it's of Ayurveda. So that's like extremely good. And a lot of people,
Absolutely.
who are planning to do Ayurveda, I think they will be inspired to do this, you know, because ये आने वाले टाइम में बहुत अच्छा, दिस इज़ अ मेडिसिन जो कि आपको भी हेल्प करेगा टू लर्न अबाउट हाउ टू लिव, एंड सामने वाले को आप जब बताओगे वो चीज़ें, तो शायद इट विल इंस्पायर यू एज वेल. सो कमिंग टू दिस, व्हाट एडवाइस वुड यू लाइक टू गिव someone who is studying Ayurveda and is planning to become a doctor?
Okay, good. Actually, many young budding Ayurveda physicians approach me. They'll say, sir, we wanted to come and learn from you and all those. So that's a good thing, because see, what my suggestion will be, whoever is studying Ayurveda or planning to study Ayurveda, you have to give at least 3 to 5 years of your
Hmm.
learning after finishing your BMS or after finishing your MD or whatever you do. 3 to 5 years, you have to be under a senior physician, whoever you find good, either work under them or whatever, and get the foundation right. So many times, even though we say, but they always keep keep doing this mistake is when they don't put the foundation proper, they cannot build a career on that. Okay. If you want to build a 10-story building, your foundation should be very strong. It has to go deep. So many doctors, young budding Ayurveda physicians, they just immediately they want to get into a job and start earning, start working, things like that. So I understand it may be a necessity or a need, but you can also earn and work under a senior physician and have that hunger to learn, have that desire to learn the fundamentals, which is missing, unfortunately, nowadays. Hardly one or two people are really, they're searching, they go to Kerala, they go to here, they search where I can learn. But majority of them just want to, they think, okay, once I finish, I become a doctor, I start practicing and then I start prescribing medicines. It's like learners, licensed people are on the road, you know. So accidents will happen and it will be serious damage. Unfortunately, the patients are getting into the problem. So I would suggest all the young Ayurveda physicians to go under a senior physician, be there for 3, 5 years, dedicate your time. So once your foundation is ready, see, first 5 years of my life, I did not have much growth. Okay. I would say 7 years at least. Because I was putting my foundation proper, proper learning. After that, the growth comes. So it's like Chinese bamboo tree, we say. So first 2 years, 3 years, the bamboo will not grow. It will be like hardly 1, 2 feet because the root is going 100 feet below. Third, fourth year, then it will go 100 feet above. That means it was actually sending the root below so that it can balance this 100 feet plant. Similarly, you have to go into the root and learn the foundation, then you will be able to build your career.
Amazing. I think this podcast was very insightful for not only the upcoming Ayurvedic doctors, बट जो लोग सुन रहे हैं राइट जो पेशेंट्स हैं जो आज की डेट में कहीं ना कहीं अपनी लाइफ में आयुर्वेदिक प्रिंसिपल्स लेकर आना चाहते हैं आई थिंक फॉर ऑल ऑफ देम इट इज़ एक्सट्रीमली गुड सो आई
Yeah,
थिंक इट वाज
great. It
फैंटास्टिक टू
was a
टॉक टू
pleasure. It
यू
was a
या
pleasure talking with you, Subham.
आई एम श्योर ये पॉडकास्ट से आपको होप तो मिली होगी कि ये कितनी ज़बरदस्त साइंस है हमारे चैनल पे अब हर हफ्ते पॉडकास्ट आते रहेंगे तो ऐसे ही होलिस्टिक हेल्थ से रिलेटेड पॉडकास्ट को देखने के लिए हमारे चैनल को सब्सक्राइब ज़रूर करें अब मैं जानता हूं कि पॉडकास्ट आप सारी देखते हैं लेकिन आप में से सिर्फ 30% लोग ही सब्सक्राइब करते हैं और इसीलिए मेरा उन 70% से निवेदन है कि आप भी इस चैनल को सब्सक्राइब ज़रूर करें मिलते हैं जल्दी अगले हफ्ते तब तक के लिए व्यस्त रहो मस्त रहो स्वस्थ रहो